here. And first of all, just a couple of housekeeping things. I think most of you know this, but this is our biweekly webinar. And, generally, if you can please stay muted while Ericca is doing your presentation, and then you can unmute when you want to ask a question. And we'd love to see everybody. If you can turn on your camera, but if you don't want to be seen, or you're at the airport or something, or a busy place, then fine, don't use your camera. So basically, we have a presentation and we leave a lot of time for Q&A and conversation, so there'll be a chance to participate. So Ericca Maas is the Executive Director of Close Gaps by 5, and she'll talk about the key role that the organization has played in promoting early childhood education in Minnesota, including its early work on establishing a rating system for quality childcare, and its current contributions to increasing the number of early learning scholarships for at-risk children. And I would just say that as many of you know that have been with us for a while, promoting early learning scholarships has been one of the things that we've done as much as we can about, particularly when our volunteers visit the legislature each year. We usually, that's one of the things we promote, is increasing scholarships, because particularly in cases of neglect, but also in abuse, having a quality early learning experience has been shown to reduce the incidence or reincidence of abuse by up to 50%, depending on the program, 40, 45, 50%. So it's a tremendous prevention tool or early intervention tool, either to make it unnecessary for families to get into child protection in the first place, or for shortening their stay and avoiding repeat visits to child protection. So that's why we have promoted it. It's one of the few programs or services that actually have a prevention impact on child maltreatment. So I'm gonna, keep it short here and let Ericca get going. So welcome, Ericca. It's a pleasure to have you here, and thanks for taking the time to talk.
Sure, of course. Thank you. Nice to see you, Rich, and others who are here in the way that we see people in 2020. My name is Ericca Maas. I'm the Executive Director of Close Gaps by 5. We are an early education-oriented advocacy nonprofit. We've been active in this space for a little over a decade, about 12 years. And our work started, or the organization started, sort of as an outgrowth of work that Art Rolnick did when he was at the Federal Reserve Bank of Minneapolis with his colleague Rob Grunwald, to look at the return on investment for investments made in helping children in low-income families access high-quality early learning opportunities. Wrote a paper, found a 16-to-1 return on investment. The business community, local business community in Minnesota, got very interested in how that research could be brought to scale in Minnesota. So what could you actually do or implement to achieve that kind of return on investment? And they founded an organization called the Minnesota Early Learning Foundation, which raised $20 million in private money from the local philanthropic community, business foundations, community foundations, and some individuals. The board was made up of business and community leaders, so some of the CEOs leading the Fortune 500 companies in the state at the time, leaders of Cargill, Best Buy, General Mills, for example, health sector, Blue Cross Blue Shield, United Health Group, and also community leaders like the president of the University of Minnesota and several foundation heads, United Way, McKnight Foundation. And that group oversaw the raising an investment of this $20 million from 2006 about to 2011. And what that money was used for was basically an applied research project. So investing those private resources in testing out some ideas, with the ultimate idea being that those things could be brought to scale statewide by the state, because the group acknowledged early on, and it remains the case today, that the investments needed, the amount of effort needed, are too big for the philanthropic sector or the private sector to handle. Sometimes in my work, I liken it to if parents were responsible for organizing, well, it's sort of an apt I suppose, thing to say now, but for organizing fourth grade for all of the kids. You know, research has highlighted for us over the last decades the importance of early learning, and we need to think of it more as education than as custodial care for children. And so when you look at the effort that it would take to bring that to scale, it's quite expensive, and there's a good case for what economists call it being a public good, right? We all get more out of it than the individual investors, in this case, often parents. So the idea was to do this applied research project. The group invested the $20 million in piloting two things mainly. The parent-aware early care and education rating system, so a child care rating system. The idea being both to give parents information about the quality of providers in their area, but also to help providers know, better understand and implement best practices for supporting early learning and development. And a complementary early learning scholarship program, the idea there being some families can afford to pay out of pocket for high quality childcare, many cannot. And so how do we support children in low income families to access quality early care and education? So they did the pilot project, invested about a quarter of the budget in research and evaluation, found both things to be working well in a pilot phase, and then from that point have worked on transitioning the programs to state programs. And a lot of that was facilitated through a $46 million Race to the Top grant that the state earned. That was about 4 years of funding that started in 2012. And a lot of that funding went to bringing the parent-aware rating system statewide, testing out the scholarship approach in a couple of other places. And then during that time, the state legislature also started investing in scholarships. And so now the state is investing about $70 million a year in early learning scholarships. And I'll talk in a little bit about how that's working. And so as the work has transitioned from being something held outside of state government and a kind of privately run pilot project to being state programs, our organization has kind of morphed as well. Whereas before we were, responsible for implementing the pilot projects and raising the funds necessary to implement the pilot projects, we're now in more of an outside of government advocacy role, supporting the programs, advocating for their expansion when the implementation isn't going well, offering constructive feedback to our partners at the state and trying to keep things on track and going well. So that's about organization and how we got started. Our scale is much smaller now than it was when we first started. We have, one me employee at this time. We used to have several, used to have a lot bigger budget, but we still do, raise, we've never been supported by any public dollars, so we raise all of the funds to support our work, still from business and community foundations and individuals. And we work, our work is also closely linked to the kind of credibility and relationships that we have with policymakers and state leaders. And so we have worked over the years to grow bipartisan support for first and foremost, an understanding and legislators and others who will champion the cause of early care and education, in particular for children in low-income families. That's critically important to our work. And then obviously the two programs that I mentioned, early learning scholarships and the parent-aware quality reading system. So, in terms of how we fit into the landscape of early childhood organizations, we are not a service provider. We're not a frontline provider. We don't, several nonprofits are involved in administering the programs that I mentioned. We don't do that. We are really have a pretty narrow mission to work outside of government on supporting and pushing for the implementation of these programs and advocating for their existence and expansion. I guess we talk about ourselves as being an honest broker because we do not provide services. We will never, my board members will never be beneficiaries of these programs directly, either through, contracts or serving children in programs or whatever it may be. And we continue on that path. So that's about us. And now I'm going to transition to talking just a little bit more in depth about scholarships, and a little bit about the parent aware ratings. And then I'll conclude by just sharing with you some of the challenges and opportunities going forward. And then we can have some discussion. In terms of the early learning scholarship program specifically, scholarships may only be used at programs that have a parent aware rating. So that could be a home-based program or a center-based program that has voluntarily said, I want to partner with the rating system and make known the quality of my program or have the quality of my program evaluated and receive supports. And it's a lot of emphasis on the support side. So if a provider raises their hand and wants to volunteer, they work with a coach who meets them where they are. You start with a sort of self-assessment to say, okay, here are the things that are great that are happening in this program now. Here are a couple of extra steps that this program could take, a couple of extra best practices that could be implemented to improve the quality of the program and ultimately, the services that children are receiving. So there are about a little less than 3,000, or there were pre-COVID, everything's a little up in the air right now, but about 3,000 programs statewide that have volunteered to be rated. That's about a little under a third of all the programs. Some are centers, some are home-based programs in every county of the state, as far as I'm aware. And there might be one county with, I think every state, or every county, excuse me, has rated programs. And so, that program exists again to assure that the children who receive scholarships are able to and are getting access to the kinds of high quality programs, the kinds of best practices that we know result in the return on investment that I mentioned earlier, the 16-1 return on investment. It's not just any kid in any program. It's specifically children in low-income families or experiencing other risk factors, accessing high-quality programming in touch with, the shorthand that we use is best practices. So best practices that support their development. So the rating system is statewide, and the state is funding about $70 million, as I mentioned, of early learning scholarships. And those scholarships go to children in low-income families are eligible to receive a scholarship. There is obviously a limited number. There's not funding for every eligible child to receive a scholarship. So there's some eligibility criteria in place. It's tied to free and reduced price lunch. So children and families at or below 185% of poverty, or about $45,000 for a family of 4. It started out being just 3 and 4-year-olds who were eligible the 2 years prior to kindergarten. However, one of the good changes that have been made along the way is to expand eligibility to infants and toddlers in some specific circumstances. And those circumstances are experiencing homelessness, in foster care or child protection system, or children of an adolescent parent. And that was done in acknowledgement of the research in terms of, we talk a lot about targeting in terms of ensuring that the right kids are prioritized for services, and at the center of that target is children in the groups that I mentioned. And so we really wanted to, with the limited resources available, make sure that we could get that targeted group access to scholarships, even in a circumstance where we know there are not enough of them. And so how do we serve those children first? And so when the policy was changed to allow eligibility for those groups of children, those children were also prioritized. And so it is the case that Organizations that are responsible for awarding scholarships set aside a portion of money to make sure, or with the goal of being able to serve children in priority groups as they apply. And so I think right now those organizations are setting aside about a third of the money that they have to spend on scholarships for children in priority groups, which is a good start. And I'll give some numbers now, and I don't have slides because I wanted to see your faces while I talk to you. So hopefully this comes across okay, isn't too confusing. So there are about 15,000 scholarships that are being awarded right now on a statewide basis. About 20% are going to children who are infants and toddlers, and the remainder are going to children who are preschool age, so ages 3 or 4, and in some cases 5-year-olds who haven't started kindergarten yet. About 50% of the children identify as children of color, and the children receiving scholarships report speaking 71 different home languages, and that's represents about 16% of the population of children receiving scholarships report a primary language other than English as the first language spoken in their home. So that's about the whole total of the 15,000 children who receive scholarships. As I mentioned, several groups of children are prioritized. And that's about a quarter of the whole population are children who are in one or more of the priority groups that I mentioned. And so that includes about 1,200 children in foster care, about 2,500 children whose families are experiencing homelessness, about 150 adolescent parents, children of adolescent parents, teen moms primarily, and 179 children in protective services. So, and of that group, there's some discrepancies with how things are counted here, but it is about 20 infants, about 70 toddlers, and about 90 preschoolers. So children ages 3 or 4 who haven't, kids who haven't started kindergarten yet are preschool aged. So that's the, kind of the big picture, who's receiving these scholarships, a little bit about the priority populations. I think but definitely the policy change that was made to prioritize some children and to expand eligibility to infants and toddlers has been helpful in terms of assuring more scholarship resources go to infants and toddlers, which the research would say is the place to start. And also that the limited dollars are also being targeted to the children most at risk. I think in terms of challenges, obviously, about 180 children in protective services are receiving scholarships, knowing that children with that status are prioritized. And I think in the other priority groups too, you could raise this question, why isn't the penetration higher than it is? And it's something, Rich and I talked about before you all joined this call, and something that maybe the group can talk about. And I think there are some follow-up things that can be done to get more information or to come up with an action plan for changing that. I mean, obviously, by our estimates, there are about 35,000 children in the state who would be income eligible. This isn't just priority populations, but children who are in families meeting the income threshold prior to COVID. Again, that will probably change over the coming months. But so about 35,000 children who don't have access to any kinds of, Head Start or childcare systems or scholarships, any kind of support to help them access high quality early care and education. So, one of the things obviously that we're working on is getting more resources for scholarships, and in doing so, more would be available obviously also to children in priority groups. But the outreach question, I think, is independent of that, as something that we want to address, as part of what is just I think a perpetual important policy question, which is, are we using these resources to the maximum effect? Are we reaching the kids who need it most? These questions are sometimes challenging when you know there's underfunding, or you know that there are the need is so great. But I think it's incumbent on advocates and policymakers to, again, make sure that the resources that are available are being used to the best effect, with the acknowledgement that it's not, we're not going to serve everybody in the current circumstance. So that's it. So, lack of funding is a challenge. I think a challenge is assuring that we're doing the absolute best with what we have. Provider availability is something, so thinking about, again, a family can only use their scholarship to access a parent aware rated childcare program. That obviously limits the amount of programs that families have to choose from. It's something that we've worked on together with the state, thinking about how you make use of the resources that are available to support providers, to target supports to providers that are serving high numbers of children in low-income families or certain geographic areas. It's something that has been done over time. I have not, it's not a common concern that is raised by scholarship administrators that families can't find a place to use their scholarship. That hasn't come up. There is some flexibility, if a provider is willing to just get started in the process and sign up, they can start serving a scholarship family. But what we see is that the vast majority, probably, I haven't looked recently, but 85% perhaps of children are served in the highest rated programs, 3 or 4-star programs. So it does seem that families are finding options. We always want to, improve choice and make more options available. So that's something that that we advocate for and that we're working on the state with. We also work on efforts to improve the rating system over time, improve the incentives that are available for providers, the supports that are available, make sure the process is accessible and easy for providers to use, and to improve the measures and the best practices that providers are rated against, to ensure that it's that set of indicators is matches the best and most current research on what children need, and that's an ongoing process that we work through and advocate on. Another issue or challenge that we made some progress on recently is that scholarships were previously capped at an amount of $7,500 per child. That amount hadn't changed for a long time, and hadn't changed as infants and toddlers became eligible. And infant and toddler care tends to be the most expensive because the ratios are incredibly low, 1 to 4 for an infant, 1 to 6 for toddlers. It's an expensive service to provide. And so we had been advocating over years to allow for the scholarships to pay higher amounts that are more reflected in the childcare market, in particular in urban areas where it's more expensive. This year, the Commissioner of Education did raise the amount available to children in priority groups to $10,000 a year, which covers more providers. Certainly, that covers most home-based providers in the state for the infant and toddler age group, not centers yet. So we'll keep working on that. But it is a step in the right direction. We had been hearing that children were losing learning continuity with families, starting in programs, running out of resources partway through the year, and then children unenrolling or dropping out of programming, which is a cause for concern. Obviously, continuity is incredibly important. So we hope that this change solves some of that issue. It's also the case that a lot of times providers will serve children for as much as as much money as the family can bring, even if that doesn't cover the tuition. A lot of times providers are kind of eating that extra cost, which for many providers isn't really a sustainable business practice. So that's something that we're working on. And then, of course, always working to make sure that policies are child-centered and family-friendly. There are some some issues that we worked on over the year to make sure that parents, if they change addresses or jobs or need to change providers, can easily move their scholarship from one provider to another, things like that. I mentioned the issue with the cap, assuring continuity of care is really important. And then the last thing that we're looking at, or sort of the last group of issues that we're looking at and advocate on are, we want to be able to track the impact of this program on children, not just who's being served, but how is it working? What can you tell from later on in the educational experiences of these children? Has it made an impact? Those kinds of things. The state isn't really set up to collect or report on, or to understand, I guess, what's happening. And so that's something that we've worked on, better integrating the very many systems of support that are available for children in the early years, so that it's not such a complex system for parents to navigate, and so that things make sense and work together is something that we've also worked on. So that concludes what I have here on my sheet of paper. I would be really happy to have a conversation with you all. Thank you for your attention. And if nobody has any questions, then it can be done early.
Well,
I have a question.
Yeah, you go ahead. I was going to say, I don't think you're going to get off the hook that easily. Go ahead.
Hi, my name is Anna. I'm a guardian ad litem in Anoka County. And I just had a question. I'm starting to hear more about the early learning scholarship because the foster families are able to have that for the children in their care. But I was kind of alarmed that and for one particular family, they ran out of the funds, or the year expired, I'm not sure which, but then the children had to abruptly end their program at a really wonderful childcare center. I mean, they were doing so well. The worker and I had just visited them, and then pretty abruptly they were pulled because the foster parent she just couldn't afford to continue paying. And so I think it was, of course it was wonderful that they got the opportunity to go to the program, but I guess what I was so distraught about was that these kids have had so many changes in the year in terms of their foster placements, and this was just something that was consistent for them, and they're pretty little kids. So then I started wondering, foster parents receive some sort of stipend for childcare, but it's pretty low, especially with younger children. So I just hope that that situation doesn't come up again, but I wondered how common it was. I'm sorry, I'm home with my daughter here, so she's watching something. I'm just moving to a quieter area.
Yeah, sure. So it's very unfortunate. I'm saddened to hear that you're aware of one of these experiences. We know that this is happening. We have known that this is happening, and it's particularly concerning in the circumstance that you mentioned, where childcare can provide a lot of stability for children whose home situation is in flux. So how often is it happening? We went through a process working with the Department of Education and found that it doesn't appear to be happening in very many cases, which, it's maybe, it doesn't mean it's not a policy problem, but I was surprised. We looked at the amount of resources that individual children were using of their scholarship, and it was about 10% of kids that were running up against that cap. Mm-hmm. So we worked with them on a couple of different ways to try to get more flexibility. When there's resources left over from other children, can we shift some to help? And other things, and I know that in Hennepin County, for example, they have allocated some county resources to also give county funded scholarships to children in foster care. It's helped them place more young children in foster care because it can be a barrier for foster families. But it's not we need a a statewide public policy solution to that problem. And this, I think before COVID, the Department of Education had a plan to pay a higher amount than $10,000, but then they kind of pulled that back a little bit because of the pandemic, and it's a little bit unclear what's happening with the resources that they have. So we're hopeful. The commissioner definitely heard the arguments and understood the case and made that decision. And so we're hopeful that as things get back on track, I think the 10,000 will help. Again, so when you look at the case, so you look at people using all their resources, and then where we have information about what gap is left, it does seem like 10,000 is going to reduce that 10% even further. And also, like, the commissioner is open to working on it post pandemic. Yeah.
Okay, thank you.
Mm-hmm.
I'm wondering if there's a specific case of that and somebody, like Anna would like to advocate for trying to find some way to patch through.
Mm-hmm.
Is there somebody they could call? I mean, would that be you? Would that be the regional administrator? Who would people, or is it just like, that's it, don't bother?
Well, I'm not sure. So certainly I guess the problem is that the administrators have to follow the state policy. And so what the statute says, the commissioner decides how much can be spent per child on a scholarship. And then the State Department of Education says to the people who pay the scholarships, it can't be more than this amount. And so I would have to look to see, you said Anoka County, right, Anna? Yeah, so I have to look and see who the administrator is in Anoka County. I mean, so I work closely a lot with Think Small. It's a early education oriented organization. They do administer scholarships, and sometimes they have private funding, so it might be worth talking with the administrator for the scholarship, not the county. In that case, they don't have the resources, but maybe that scholarship administrator has some flexibility, or a little bit of private funding to help fill gaps or something like that, and they could help potentially. Otherwise, the childcare providers are in a terrible position. They don't want the children to leave either. They love all of the kids that they serve, and in particular, children withdrawing mid-year because of financial difficulty. That's not something any provider wants to see, but also they have to run a business, and it's really, I know they hate being put in that position.
So how would you figure out who that regional administrator is?
Yeah, so on the Minnesota Department of Education website, it lists the administrators and contact information by county or region. And so that's where you would look. And I can share that with you, Rich, if you want to share that with the group. I'd be happy to.
The other thing I would say is, one thing we're trying to do is to get some meetings with key administrators or legislators, and bring along a few advocates who are interested in the topic, or volunteers who are citizens who have some interest in that. So I don't know if we get everybody's emails when you register, but if we get something set up with Minnesota Department of Education, we'd like a few people to go with us. So if we don't get don't have your email address, maybe you could just send it to us, get on the website and send us a message. And then we've got a couple of those type of meetings we're trying to set up in the next couple of months, just to raise these kind of issues. And while I've got the floor, so to speak, one of the things that along these lines that Ericca and I were talking about before, I think Rebecca was the only person who was there, but as I said at the beginning, early learning scholarships are maybe the best single tool that is out there for either reducing the impact of abuse and neglect in real time, research-based, particularly for infants and toddlers who are the most vulnerable, and in many cases for just reducing abuse so that nobody has to go to child protection in the first place. And yet the uptake on this service has been pretty small. in child protection. It's been quite a bit better in foster care. And so we were just kind of talking about why is that and what could we do to improve it, because if you're a child protection worker and maybe there's other guardians ad litem or social workers on the call today, but that's a great service to have, because let's say you have a neglect case, you've got a 2-year-old and a 3-year-old or an infant and a 3-year-old or whatever, particularly young, could go up to 5, and mom's under a lot of pressure and she's got a case plan, she's got to work, and maybe she's got limited ability at this point in her life to be there for the kids. But if you can plug in something like 4 days of childcare, quality childcare a week or 5, that frees her up to meet the court requirements, take some pressure off of her, and gets the kids the kind of stimulation that they really need at that age, so that they don't their brains develop. And it's just a great service. So why aren't people using it? So we thought we'd do a little homework into trying to figure that out, and if there are any things we can do to promote it, to make sure caseworkers are aware of it. If there were one thing you could do in terms of us promoting a service, this would be it. I'm sorry, I forgot to mention at the beginning, you can also, this would be more useful while Ericca was talking, but send a question with the chat function too. But that's not really necessary right now, but you can still do it if somebody's talking for a while.
Question that I had, and actually Richard sent me a email with some of those numbers that you went over regarding the foster care, homelessness, teen parents, and protective services.
And can you identify yourself, Greg?
I'm a retired Hennepin County child protection supervisor. I worked in the child protection system for about 40 years, 37 of them at Hennepin County. And what I was wondering is that, in my experience, most of the kids that are in foster care enter foster care through the child protection system. So when you talk about 1,220 foster care, are those identified in any way as far as what the entry point into the foster care system was?
Not in the data that I have. I'd have to talk to the administrators to better understand what the entry point is. So it is true, the policy is that once a child receives a scholarship, it keeps renewing until they go to kindergarten. So if a child got a scholarship in a child protection case or situation, they would continue to have it into their foster care placement and so on. But no, I don't know. I don't know the answer to your question about the entry point.
I guess a similar question would be like I don't think the homelessness would have much of a carryover or a crossover with child protective services, but the teen parenthood category could possibly have a crossover. And so I'm wondering, when you say, or whoever put these numbers together, the 179 child protective cases, how exclusive are those numbers in comparison to the other 3 categories?
Mm-hmm.
It's like theoretically be unlikely, but theoretically you could have somebody who is a homeless teen parent that's active in child protection with their child or children in foster care, so they could hit all 4 categories.
Yeah, it's a good question, and I can follow up with the Department of Education to see. It does say in the text around the numbers, the context provided for the numbers, that it says at least 1, but it does not say how many children are duplicated across the different groups, or how they select which primary thing to report. So it's a good question to better understand the case count and if it really is that low or not.
I think people would be interested in understand a little more about the parent aware and the rating system, because that was a huge deal to get that done. And it's not without controversy, with rating centers as a criteria for being eligible to get those scholarships.
Mm-hmm.
family childcare providers, would have a harder time doing it. Providers who had, limited resources, say, people with lower incomes who are providers, or the deserts, that there are where there's places where there's just not the services. So maybe you can go into a little bit of that, how it works and where it's controversial and where it's beneficial.
Sure. Yeah. So the rating system, so it's a voluntary system, and there's about whatever it is, 30% or so of providers have voluntarily adopted it, and the program's been around since, I guess it's been available most places in the state since 2015. So a number of years, the supports have been available to providers, and in some places longer. So, obviously not everybody has decided to jump on board. In some places, I guess it's more controversial than others. I think that it has been more difficult to bring on board licensed family childcare providers, so home-based providers. The take-up among centers tends to be quite a bit higher, and what we see with centers is that often they'll kind of work on their own and then come in for a rating and already be at the 4-star level, whereas licensed family childcare providers, home-based providers, tend to enter the system at the 1 or 2-star level and kind of work up with the supports. So I guess the reasons why it's controversial, I guess the fundamental reason is that nobody wants to be rated. Like people who get reviews on Amazon that are negative, or are reviewed by Consumer Reports and have an outcome that they don't like. Generally, I think the rated don't necessarily love the ratings, but as consumers of lots of different things, we know that ratings can be a helpful part of making a decision, not the only determinative factor, but one of the factors that people use when they select services. So I think over the years, we have worked hard, and the Department of Human Services has worked hard, and the local nonprofits that work on the rating system have worked hard to meet providers where they are, and to really focus on emphasizing the supports that are available. And what we know is that when providers do volunteer or opt into the rating system, that overwhelmingly 90+% of providers consistently year over year say that they have a positive experience, say that the supports help the families and children that they serve. So it's kind of one of those things that, after you try it, you like it, but maybe getting to that point is hard for some providers. And certainly we don't expect or need 100% adoption. We want to have some, obviously, options, a variety of options available to families in all parts of the state. But from our perspective as an organization, quality is so critically important to children's outcomes that we aren't willing to, I guess, to support these kinds of investments like in scholarships going to any provider where quality is unknown. I think too that, in a lot of areas of the state, Rich mentioned childcare deserts. This will get worse almost certainly as a result of COVID. Many programs are suspending operations or closing. In a lot of areas in the state, and a lot in greater Minnesota, but also in some urban neighborhoods, there are childcare deserts. And so there just aren't very many providers. Providers in those circumstances are full with a wait list. And so don't really feel like they need to do extra or take extra steps to participate, to differentiate themselves from their competitors, or to demonstrate their quality.
Well, if I could ask, what are the standards and criteria for rating? How are the ratings done, and how are the centers evaluated?
So the programs are, so there's licensing, right? That can you be open or not requires you as a program to meet some basic health and safety standards, and then ratings build on top of that. So you can think about things like, do you have a curriculum or not? Are you using a developmental assessment to understand children's development and to be able to guide them in their development as individuals? What kinds of materials are available in the learning environment? How are the teachers interacting with children and supporting their individual learning? So part of it is observing teachers and caregivers and how they're interacting with kids and those kinds of things. And so providers work with a coach to document how they're doing these things. And it's very similar to the way different kinds of accreditation work. But in this case, we really tried to, there's accreditation is also an option, and some providers do accreditation and said that's great. But we wanted to build this in a way that it was really clear how providers could move up across the STAR levels instead of accredited or not accredited. Accreditation can sometimes be a lot of work. So providers volunteer, they work with a coach, they kind of submit, they document what they are doing to meet the standards, and then they generally leave the process with a STAR rating and some next steps to do and some grant dollars to help fund those next steps, so that they stay engaged in a quality improvement process.
So are all 4 levels eligible for the scholarships, or just when you get to 3 and 4?
Yeah, all 4 levels are right now. There's not enough supply. We have looked at, and in the pilot project, limited use of scholarships to 3 and 4 star rated programs because we were able to really quickly bring online in the a small pilot area enough programs. But when we look statewide at what's available, and wanting to again for parents to have access to a variety of options, we've continued to advocate for scholarships to be open for use at 1 through 4 star rated programs. And it also helps providers sometimes take that first step to, the 1 star level is, it's like maybe 2 or 3 things more than licensing to do. So it's a doable first step to be able to help, some children in your community have scholarship potentially.
Well, the other thing on my list, and somebody else interrupt if you have a question, but it's not obvious if you didn't kind of live through some of it, what a big deal it was just to get this whole thing off the ground. The Minnesota Business Partnership, is that the right term? Which is, as I understand it, it's an organization that represents the CEOs of the big firms in the state, and the Federal Reserve Bank people you mentioned, Art Rolnick, and I can't think of the other guy.
Rob Greenwald.
Yeah, Rob Greenwald, brought the research to bear, and it went from, I think, from $0 to $70 million over the course of the period of time. And it took a number of years. There was a big coalition of over 100 agencies called the Mini Minds Coalition, which just recently disbanded. That was very successful coalition in my experience. I've never actually seen a coalition be successful past a certain point, because there's too many people trying to get along together. This was, they really worked together well for quite a few years. And so it just really went from, it was a business community that got behind it, I think, that really made the difference. And it's been a huge success. You still have 15,000 kids served out of 35,000 would be the population, but that's a lot more than 0. So, I think I just said what I was going to ask you to say, but is there more to fill in on that? That's my understanding of how it all worked out.
Yeah, I think it is. It's work that I definitely have been proud and excited to be a part of, because, as you mentioned, when something happened, something changed, something happened, and that's always nice in the advocacy efforts. And I think, due in part, as you mentioned, to a wide variety of organizations kind of coming together and working together. And so from my perspective, I don't dwell on it probably almost ever. But yeah, I think if you look back, you can see that we've come a long way and that a lot has changed in recent years. It's never fast enough and it's never enough. And so I think, so again, I think it's been great. And we need to keep on working because as we come out of this pandemic, I think it's going to be more important than ever to help support kids' development and make sure they're ready for school. I do think the business community involvement has been a great addition to the effort. It has helped things along. It's good part of a well-rounded coalition. I feel like I do, one of the things I have here on my paper that I haven't mentioned is, or maybe haven't talked about enough, is that this issue really, so I think we've had success in terms of garnering resources and moving these programs forward, but I think also the bigger success really has been in, when I started advocating on this issue in 2010 or 11, there just wasn't a real will or awareness around investing in early education at all. And that has changed over time. I think the work that at the Fed and other efforts to educate the public and policymakers around the importance of early investments and how achievement gaps that we talk about so much really start, when children are infants. You can measure gaps when kids are 18 months old. Some things, some disparities even start in the prenatal stage. So I think that has changed over time, and that's a real success and a real win. And it's led to this being a truly bipartisan issue. I mean, we have made a ton of progress, and we've made a ton of progress in all kinds of different configurations in state government in terms of who's controlling the legislature, who the governor is. And it's true in Congress as well. There are almost none, maybe issues, no issues, where there's bipartisan support left, infrastructure maybe, but childcare continues to be an issue. In the last 4 years, there's been a major couple of increased investments in Head Start. There have been increased investments in the funding that comes to the state for a childcare assistance program. And some grant programs that have continued from the Obama administration, the Trump administration. So this issue really, it looks likely, it's an issue that's being talked about more in the election than some others, or more than it has been in the past. Childcare specifically, obviously, it's a huge issue for the economy, getting the economy back on track. So I think, I think that all of those efforts have contributed and gotten us to this point. And I hope that regardless of what happens in November, that we'll be able to continue making forward progress.
Yeah, I personally have benefited from the program with the Parent Aware rating. And when my daughter was born in 2016, I found it to be really useful and, figure out what exactly was available in my area. And it's also nice to see that sign posted on, the in-home child cares in the centers around here. So I think it's very useful. And I just gave a parent the link for the website because she's looking at going into the workforce. And she said, I just don't even know where to begin with finding a child care because I've just never had a need until now. So I think it's a really user-friendly tool, the website, and then getting, you can get the packet mailed too. So it's just, there's a lot of ways to get the information.
That's great. Glad to hear it.
Mm-hmm.
Yeah, and I think,
What's your sense as far as the funding for the scholarship monies?
Well, I guess I'm hopeful that it's going to be ugly in terms of cuts. The state government is facing a huge deficit, and a lot of people who are active in the field remember back to 2003, 2008, other times when the state has faced deficits, and when human services programs were cut, childcare programs were cut, and so we're hopeful as advocates, and we're going to be working obviously like crazy to try to maintain the level of funding that's available now. And I guess the reason that I'm hopeful is what I said earlier, that I think people view these things as important for children. You know, there's a change, and I think people see a little bit more value, a little bit more the importance of early education, not just, you know, a place for people to put their kids during the day, but a place where children learn and develop and grow. And the kind of the clear role that childcare has to play in getting the economy back on track. I think those two things give me some hope that there won't be cuts in this area. But in terms of increased funding, definitely not at the state level. You know, it's just not going to be possible. But if the federal government continues to feel pressure to deficit spend to fund, pandemic relief kinds of efforts, I do think it's possible that they've spent some money on childcare so far, just in terms of trying to keep providers online. And so I think some of that funding continuing is a possibility. And I also think it's not out of the question that there would be some kind of more major effort around childcare. I think that the fallout in terms of the kind of pressure put on families in the pandemic has really also heightened the awareness about the need that families have for support accessing childcare, keeping more childcare options available, helping families pay for childcare, whether that's through a tax credit or some kind of a subsidy or something else. I feel hopeful that this is an issue that that's near the tops of lists, and is something that people can agree on more than anything else. I mean, there are a lot of things obviously that would make sense to do, but this is a thing that it seems like people can agree on doing.
Great. Well, that might be a good point to wrap up on. We're at the hour point. I want to thank all of you for participating, for joining the webinar. We really appreciate it. And thank you, Ericca, for your expertise. You've been very modest about your role in all this, but you've been just a key person in this whole, you've been a linchpin in this for the last 10 years or whatever. So, you can be modest on your own behalf, but you can't make me do that. So,
Nice.
Thank you for all the effort you've put in over the years. You've made a huge difference with your work, and we appreciate it. So if people have questions or follow-up, just, send an email, and we'll take care of that. And again, thank you all so much for showing up.
Thank you.
Thank you.
Nice to talk with you all. Have a good afternoon.